If you've ever been to the doctor's office, you often have had your blood drawn, and the list of results is very overwhelming. So in this video, I'm going to break down what blood results are, which ones are important, and how you can fix ones that are abnormal. My name is Joel. I'm a nurse and a naturopath for 20 years now, and I am determined to make health topics simple and easy for you to implement for yourself and for your family. The first blood test that we're going to talk about is the CBC, and that is the complete blood count. On the complete blood count, or the CBC, you're going to see WBCs, and that is the white blood cell count. Your white blood cell count tends to be elevated if you have an infection in your body anywhere. It can be an infected wound, it can be pneumonia, any sort of infection in your body will cause your white blood cell count to rise because your body is trying to fight that infection. So it's producing more white blood cells. That's a good thing. Now, how to combat infection in your body kind of depends on where the infection is, but there's a couple things, two things that you can do regardless of where the infection is. Number one, you can eat raw garlic. Eat raw garlic twice a day, 3 times a day, and you can eat it in a variety of ways. I like to crush it onto an avocado sandwich. That's one of my favorite ways to eat raw garlic. The second way is to do a contrast shower. Studies have shown that up to 30% white blood cell count increase when you take a contrast shower. That's 3 minutes hot, 30 seconds cold. Do that 3 to 5 times. And each time you're getting a boost of white blood cells. Again, white blood cells are your body's fighters. So having an elevated white blood cell count does not necessarily mean a bad thing. It means your body's trying to fight something. So you want to assist it. Do everything in your power to assist it. The next value that you need to pay attention to on the CBC is your hemoglobin level. And that should be between roughly 5 and 17-ish. It's a little different for men and women, but in the hospital, we generally transfuse people if their hemoglobin drops below 7. So how to get your hemoglobin up is green leafy vegetables, raw. You can juice them or eat them raw. Blackstrap molasses, a tablespoon in some hot water and a little bit of honey makes a great tea. And Floradix, Floradix. You can find it on Amazon. It's one of the best liquid forms of iron that I've found. Those iron pills and stuff, most of those are not bioavailable. They'll go into your gut and constipate you. So you want to get some bioavailable iron like Floradix or just straight from the source. Green leafy vegetables, chlorophyll is a great source of iron. Real quick tip on your hemoglobin and your hematocrit. If they're elevated, that's a sign that you may be dehydrated. All right, we're going to move on to the BMP, Basic Metabolic Panel. And on this one, the values that you really need to pay attention to are glucose, your blood sugar, and a few electrolytes. But your glucose should be between 70 and 100 roughly. If it's elevated, you may be pre-diabetic, maybe you're diabetic and you don't know it. Electrolytes, sodium, 135 to 145 is a normal range for sodium. Sodium, gets a lot of bad press, basically. There's definitely better salts that you want to use, like Himalayan or sea salt or Celtic salt. You don't want to use just white table salt because that's an acid and it's really not good for your body. And that's really what they're talking about when they talk about your blood pressure being elevated because of salt. Potassium, 3.5 to 5 is normal generally. If your potassium is low, eat a banana a day. That's a really great one. Avocados is another good source of potassium. Those are pretty much the 2 electrolytes that are most talked about. Now, The kidney numbers, the BUN, creatinine, GFR, those generally are not a problem unless you actually have kidney failure. So I don't want to talk about those too much, but BUN is between 7 and 20. Creatinine is between roughly 0.6 to 1.3-ish. Again, the numbers are different for men and women, but if your kidney numbers are elevated, you really need to drink more water because that's another sign of potential dehydration. You may have a kidney infection, you may have a kidney stone, those types of things. But the most simple explanation for mildly elevated kidney numbers is dehydration. And from what I've seen, really, most of America is chronically dehydrated. So one thing that you can do if you are in kidney failure, though, is charcoal. Drinking charcoal water helps to pull those toxins that your kidney is struggling with. Lipid panels, so HDL, LDL, those are complicated, overcomplicated. Basically, cholesterol is like the way that they've made cholesterol the bad guy is like calling firemen bad because they're always at a fire. Cholesterol in itself is like the little repairman for your blood vessels. The fact that your blood vessels need repair is not cholesterol's fault. That's stress, that's acid foods, that's a lot of sugar, processed sugars. They make micro holes in your vessels that need repaired. And so cholesterol comes and helps repair them. So if your cholesterol is high, fixing your stress and fixing your diet is the first place to start, not going on a low cholesterol diet, because cholesterol is very important, especially for hormones. I'm going to be doing a video next probably on female hormones because I keep seeing it over and over and over and over. And it is really the biggest conspiracy in our society, getting women's hormones out of whack so that we can then treat them like they're crazy. So hemoglobin A1C, I think, is going to be our last one. Should be less than 5.7 for you that are diabetic. You understand that yours is probably higher than that if you've been diagnosed. If you are interested in figuring out how to lower that, it's a whole course. There's a lot to it. Join my school community. We're going to be talking more in depth about how to get rid of diabetes. And because blood sugar and blood sugar spikes are the source for a lot of things, including cancer, thrives on blood sugar spikes. So figuring out how to soften those spikes is incredibly important. Vitamin D, optimal range is 40 to 60. Get out in the sunshine. Just be in the sun. At least 10 minutes a day is really going to help your vitamin D level. But if it's really low, you really should take a supplement and try to get one of the high concentration supplements and just go nuts. It's one of those things that you can't really overdose on. Your body will get rid of anything extra. What else? Liver functions, ALT, AST. Sometimes those can be high. Normal is 7 to 56 for the ALT. AST is 10 to 40. If those are high, your liver is just working really hard for some reason or another. And so a lot of that is diet. Stress can also affect it, but you can do lemon water every morning. That is really going to help your liver function. If it's really high, you can do castor oil packs over your liver, and your liver is just under your ribs on your right side. So you can do a castor oil pack. Dandelion root is also one of my favorite for liver healing. So in general, though, diet and stress are the two things that you're going to want to fix if your labs are out of whack in any way. If you have any other questions, please join my school group. It's free, and we are having a great time over there. So be blessed.